Welcome to our muscle movements anatomy video. I'm Gabby.
I'm Mariela.
And the purpose of this video is to show you different muscle movements.
Movement name is flexion, and its selector joint includes the ball and socket joint. And its muscles involved are a coracobrachialis and biceps brachii. An agonist would be anterior deltoid, and antagonist would be posterior deltoid, and it is in the sagittal plane. A real-world application would be picking up a backpack. Extension movement includes a ball and socket joint, and its muscles involve the teres major. Agonist is posterior deltoid. Antagonist is anterior deltoid. It is in the sagittal plane, and a real-world application would be putting down a backpack.
Movement name is abduction. The selected joint is the ball and socket joint. The muscles involved are gluteus maximus, gluteus minimus, piriformis, tensor fasciae latae, and sartorius. The agonists are the gluteus medius, tensor fasciae latae, gluteus maximus, and piriformis. Antagonist is the iliopsoas and gluteus maximus. This all takes place in the frontal plane, and a real-world application would be a ballerina doing a pirouette. Movement name is adduction. The selected joint is a ball and socket joint, and the muscles involved are adductor magnus, adductor longus, adductor brevis, gracilis, and pectineus. Agonist is the iliopsoas and gluteus maximus. Antagonist is the gluteus medius, tensor fasciae latae, gluteus maximus, and piriformis. This all happens in the frontal plane, and a real-world application would be going from second to first position in ballet. Movement name is dorsiflexion, and it involves the hinge joint. Muscles involved are extensor digitorum longus, fibularis tertius, and extensor hallucis longus. Agonist is the extensor duritorum longus, and the antagonist is tibialis posterior peroneus longus. It takes place in the sagittal plane, and a real-world application would be stopping a soccer ball. Movement name is plantar flexion. It's a hinged joint, and the muscles involved are plantaris, flexion digitorum longus, tibialis posterior, fibularis longus, and fibularis brevis. The agonist is tibialis posterior peroneus longus, and the antagonist is extensor digitorum longus. This all happens in the sagittal plane, and a real-world application would be pressing on a gas pedal. Movement name is eversion, and it is the subtalar joint. The muscles involved are fibularis tertius, fibularis longus, and fibularis brevis. The agonist is the extensor digitorum longus and peroneus longus. The antagonist is the tibialis posterior, and it is in the frontal plane. A real-world application would be running with a soccer ball and kicking it.
The movement inversion includes the subtalar joint, and the muscles are flexor digitorum longus, flexor hallucis longus, and tibialis anterior. Agonist would be tibialis posterior, antagonist would be extensor digitorum longus and peroneus longus. It is in the frontal plane. A real-world application would be kicking a soccer ball.
Movement name is ulnar deviation. It's a pivot joint. Muscles involved are extensor carpi ulnaris. The agonist is the flexor carpi ulnaris, extensor carpi ulnaris, extensor digiti minimi, and the antagonist is the radial deviators. It's in the frontal plane, and a real-world application would be unlocking a house. Movement name is radial deviation. It is a pivot joint. Muscles involved are extensor carpi radialis longus. The agonist is the flexor carpi radialis, extensor carpi radialis longus, extensor carpi radialis brevis, abductor pollicis longus, extensor pollicus longus, extensor pollicus brevis, and the antagonist is the ulnar deviators. This takes place in the frontal plane, and a real-world application would be turning a doorknob.
The movement lateral rotation includes the pivot joint, and the muscles are gluteus maximus, piriformis, obturator internus, superior gymnus, inferior gymnus, quadratus femoris. Agonist would be piriformis, gluteus maximus, iliopsoas, and gluteus medius. Antagonist would be tensor fascia latae and gluteus medium. It is in the transverse plane, and a real-world application would be when a swimmer starts their breaststroke. The movement medial rotation includes the pivot joint. The muscles are gluteus maximus, gluteus minimus, tensor fascia latae, adductor magnus, adductor longus, adductor brevis, gracilis, and pectineus. Agonist would be tensor fascia latae and gluteus medium. Antagonist would be piriformis, gluteus maximus, iliopsoas, and gluteus medius. It is in the transverse plane, and a real-world application is when a swimmer finishes their breaststroke. The movement hyperextension includes the ball and socket joint. The muscles are the supraspinatus, infraspinatus, teres minor, and supracubularis. Agonist would be deltoid, antagonist would be latissimus dorsi. It is in the sagittal plane, and a real-world application is when swimmers are starting their relay. The movement circumduction includes the condylar joint, and the muscles involved are pectoralis major, subcubularis, coracobrachialis, biceps brachii, supraspinatus, deltoid, latissimus dorsi, teres major and minor, infraspinatus, long head of triceps. It has no agonist or antagonist, and its plane are multiple. A real-world application includes jump roping in a group.
The movement name is opposition. The joint is saddle and condylar. The muscles involved are abductor digiti minimi, flexor digiti minimi, brevis, and opponens digiti minimi. The agonists are the opponens pollicis, antagonist is the ad pollicis, extensor pollicis longus, and brevis. There are multiple planes that this is involved in, and a real-world application would be eating a sandwich.
The movement supination includes the condylar joint. The muscles are biceps brachii, supinator. Agonist would be biceps brachii and supinator. Antagonist would be pronator teres and pronator quadratus. It is in the transverse plane, and a real-world application would be saying hi to somebody. The movement pronation includes the condylar joint. The muscles are pronator quadratus. Agonist would be pronator teres and pronator quadratus. Antagonist would be biceps brachii and supinator. It is in the transverse plane, and a real-world application would be when a basketball is being dribbled.